Rational emotive behavior therapy. Rational emotive behavior therapy is a type of cognitive behavioral therapy developed by psychologist Albert Ellis. REBT is an action-oriented approach that's focused on helping people deal with irrational beliefs and learn how to manage their emotions, thoughts, and behaviors in a healthier, more realistic way. When people hold irrational beliefs about themselves or the world around them, problems can result. The goal of REBT is to help people recognize and alter those beliefs and negative thinking patterns in order to overcome psychological problems and mental distress. According to REBT, cognition, emotions, and behavior are connected in order to understand the impact of events and situations that people encounter throughout life. It's essential to look at the beliefs people hold about these experiences and the emotions that arise as a result of those beliefs. Techniques. A core concept of REBT is the ABC model. This model explains how, while we may blame external events for unhappiness, it is our interpretation of these events that truly lies at the heart of the psychological distress. ABC is an acronym for activating event, which is when something happens in the environment around you. Belief, which describes your thoughts about the event or situation. And C, consequence, which is your emotional response to your belief. So this is just a diagram that shows that the activating event, it could be external or internal. And then your beliefs are rational or functional, but you also have irrational or dysfunctional. And then the consequence of that is emotional, behavioral, adaptive, or maladaptive. Identifying beliefs and applying the ABC model. During REBT, your therapist will help you learn how to apply the ABC model in your daily life. If you're feeling depressed due to a conflict in your relationship, for example, your therapist may help you identify the activating event for your problem before encouraging you to figure out which beliefs led to your negative feelings. They would then work with you to change those beliefs and ultimately your emotional response to the conflict. An important step in this process is recognizing the underlying beliefs that led to psychological distress. In many cases, these are reflected as absolutes, as in I must, I should, I can't. Some of the most common irrational beliefs include feeling excessively upset over other people's mistakes or misconduct, believing that you must be perfectly competent and successful in everything to be valued and worthwhile, believing that you will be happier if you avoid life's difficulties or challenges, feeling that you have no control over your own happiness, that your contentment and joy are dependent upon external forces, holding unyielding beliefs that these makes it almost impossible to respond to activating situations in a psychologically healthy way. Possessing rigid expectations of ourselves and others only lead to disappointment, um, regret, and anxiety. Disputation. One step toward changing your beliefs is undergoing a process called disputation. During disputation, your therapist will challenge your irrational beliefs using direct methods. They may question your beliefs head on, causing you to rethink them, or they could ask you to imagine another point of view that you haven't considered before. Disputation is meant to teach you lifelong skills to help you manage your emotional response and overall mental health. While each therapist may approach disputation differently, challenging your beliefs is part of the process. Ellis suggests that rather than simply being warm and supportive, therapists need to be blunt, honest, and logical in order to push people toward changing their thoughts and behaviors. gaining insight and changing behavior. An important part of the REBT process is learning how to replace your irrational beliefs with healthier ones. This process can be daunting and upsetting, and it's normal to feel some discomfort or worry that you've made a mistake. However, the goal of REBT is to help people respond rationally to situations that would typically cause stress, depression, or other negative feelings. When faced with this type of situation in the future, the emotional, healthy response would be to realize that it's not realistic to expect success in every endeavor. All you can do is learn from the situation and move on. Three key insights that REBT teaches. One, you are worthy of self acceptance no matter what, even when you struggle or make mistakes. There is no need for shame or guilt. Others are also worthy of acceptance, even when their behavior involves something that you don't like. Three, negative things will sometimes happen in life, and that doesn't mean that things are happening in a way they shouldn't be. Life is not positive all the time, and there's no rational reason to expect it to be. While REBT uses cognitive strategies to focus on emotion and behaviors as well, in addition to identifying and disputing irrational beliefs, therapists and clients also work together to target the emotional response that accompany problematic thoughts. Techniques that might be encouraged include meditation, journaling, and guided imagery. What REBT can help with. REBT has some data to support its benefits in a variety of conditions, including anxiety and distress, depression, disruptive behavior in children, obsessive compulsive disorder, and social anxiety disorder, psychotic symptoms. REBT has shown promise in sports psychology where it can be used to help athletics overcome irrational beliefs that may be negatively impacting their mental health and performance. Benefits of REBT. While developing REBT, Ellis's goal was to create an action-oriented approach to psychotherapy that produced results by having people manage their emotions, cognitions, and behaviors. Indeed, research suggests that REBT is effective at reducing irrational beliefs and changing behavior. We see the same result in sports psychology, where REBT can decrease irrational beliefs and reduce anxiety for athletes. Overall, REBT offers several behavioral benefits, like reduced feelings of anger, anxiety, depression, and distress, improved health and quality of life, better schools performance, and social skills. Things to consider. REBT can be a daunting process. For some, distribution may feel aggressive and confrontational, and facing irrational thought patterns can be difficult, as it's not easy to accept these beliefs as unhealthy. The process of changing these thoughts can be even more challenging, as it may involve learning to let go of long held beliefs. REBT is meant to teach you lifelong skills, and as such, it's not a passive process. Your sessions may involve reading assignments and homework, and you'll likely have to step out of your comfort zone to get the benefits of this form of therapy.